Over the course of a lifetime, the female endocrine system resembles a highly volatile landscape. Estrogen and progesterone rise, fall, and crash in a complex rhythm. Modern medicine usually approaches this labyrinth by breaking it into isolated synthetic pieces, prescribing birth control pills to manage youth, and then entirely different lab-made hormone replacements to handle menopause. Curious tone. But buried in the soil of the Himalayas is a botanical anomaly. This is Asparagus racemosus. In Ayurvedic medicine, it goes by the name Shatavari, which translates roughly to she who possesses 100 husbands, or the 100-rooted. Thousands of years ago, the ancient text known as the Ayurveda labeled this root Narayani, describing it as an embodiment of divine energy. The text made a bold claim that this single plant could treat almost every ailment within the female reproductive system. Biologically speaking, that sounds impossible. How could one single root navigate the shifting stages of a woman's life and effectively replace an entire pharmacy of targeted medications? The answer lies in a specific group of biochemical compounds hidden inside the root, known as Shatavarin 1 through 4. These are steroidal saponins. Structurally, these molecules have a high binding affinity for human estrogen receptors, which allows them to bind directly to cellular surfaces. These phytoestrogens function as natural mimics of human hormones. By occupying these receptors, they allow the root to modulate the endocrine system, creating a botanical baseline that can help stabilize fluctuating hormone levels. The first major biological battleground for women happens between their teens and 30s. This is an era often defined by erratic hormonal spikes and crashes, leading to painful menstruation, irregular cycles, and conditions like PCOS, or polycystic ovary syndrome. Long before modern diagnostics, an ancient medical text called the Ashtanga Hridayam pioneered the use of Shatavari specifically to treat these reproductive and menstrual disorders. This chart shows how the root actually pulls that off. Look at the highly volatile, spiking estrogen line. When Shatavari's phytoestrogens are introduced, they act as a buffer. They regulate dramatic estrogen spikes, smoothing the erratic wave into a healthy rhythm. Now look at the second data line. Because Shatavari is an adaptogen, it actively suppresses cortisol, our primary stress hormone. By recalibrating both the reproductive and the adrenal systems, the plant avoids merely masking the symptoms of PCOS the way synthetic birth control often does. It treats the source of the chaos directly. As a woman transitions into motherhood, her physiological demands abruptly shift towards fertility, sustaining a pregnancy, and producing breast milk. The Charaka Samhita, another foundational Ayurvedic text, elevates Shatavari during this phase, placing it at the very top of the Jivanya Gana, a select category reserved for the most vital, life-promoting herbs. To unlock its power for mothers, ancient physicians used a preparation method called kshirpak. They boiled the powdered Shatavari root directly in milk. Because many of the root's active properties are fat-soluble, the boiling milk effectively pulls those crucial compounds out of the plant structure. Modern endocrinology provides the exact mechanism for why this works. Once ingested, these active compounds travel through the body and directly stimulate the secretion of prolactin, the hormone responsible for milk production. This specific effect is so well documented today that the World Health Organization recognizes the plant's effectiveness. In medical terms, it is an established galactagogue. A milk-boiling remedy recorded thousands of years ago is backed by scientific certification as a safe tool to help struggling mothers produce breast milk. The final major biological shift arrives with menopause. As the ovaries naturally slow down, natural estrogen levels plummet, triggering physical fallout like hot flashes, vaginal dryness, and rapid losses in bone density. To combat the physical toll of aging, the ancient Sushruta Samhita championed a preparation called Shatavari Grita, which involved extracting the root into clarified butter. The relief it provides comes down to microcellular action. As the body's natural estrogen vanishes, it leaves behind thousands of empty cellular receptors. The plant-derived Shatavarin molecules float through the bloodstream and dock perfectly into those empty spaces. This gentle, organic binding provides a stark contrast to lab-made hormone replacement therapy, which forces synthetic hormones into the system and carries a heavy risk of unwanted side effects. By acting as an accurate estrogen surrogate, Shatavari tricks the body out of menopausal shock, offering sustained relief without the risks of lab-made chemistry. Shatavari functions as a bioadaptive tool, shifting its biological influence to match the specific hormonal requirements of whichever decade it is introduced to. Modern clinical trials are now expanding the scope even further beyond reproduction. Researchers are documenting potent immune-boosting properties and even isolating compounds like Racemosul, which show active anti-cancer properties within the root. The history of this root traces a massive arc. It moves from the poetic verses of the Atharva Veda thousands of years ago directly into the hard clinical data of modern laboratories and WHO certifications today. This ancient use of the root suggests that early physicians identified a precise botanical intervention for complex cycle issues, navigating the hormonal landscape long before the advent of modern biochemistry. It remains exactly what those ancient texts claimed it to be, the queen of herbs, and a lifelong ally for women's health.